SIBO, small intestinal bacterial overgrowth. What is this condition? What are its symptoms? Is it a serious disease? Can it cause major health problems if left untreated? Does it always require treatment, or can dietary adjustments help manage and prevent it? What are the steps for its treatment? Are there any dietary supplements that can help treat SIBO-related issues? Wait for me. Hello, I am Hussein Lotfi, and you're watching a new episode of my show on the Octopus Pharmacist channel. Welcome. In this episode, we have today's topics, and if you need any specific title, you can jump to the minute where it starts. If you want to learn everything about SIBO, small intestinal bacterial overgrowth, stay with me from the beginning to the end. Now, let's begin as we usually do, and let's dive into the details of the disease. Understanding SIBO, small intestinal bacterial overgrowth. 1. Where do our natural bacteria live, and are they helpful? Our body has natural bacteria, which are beneficial, and these bacteria are mainly found in the colon, large intestine. These bacteria help break down some of the food we eat and process waste material our body no longer needs. They also produce many important substances. However, their main job is in the colon. The concentration of bacteria is much lower in the small intestine. 2. What happens in SIBO? In SIBO, the bacteria that belong in the colon move into the small intestine, which creates an imbalance in the digestive system. This can lead to many health problems, as the bacteria begin to interfere with digestion where it should not normally occur. 3. Why do bacteria move to the small intestine? There are several reasons that can cause this imbalance. A. Impaired intestinal movement. When the movement of the intestines or colon slows down, the bacteria can move from the colon to the small intestine. This may occur in people who have undergone surgery, like weight loss surgery, bariatric surgery, or in people with diabetes. In diabetes, nerve damage, called peripheral neuropathy, can affect the signals that control the movement of the stomach and intestines, leading to slower movement. B. Nerve dysfunction in diabetes. With nerve damage, the stomach and intestines don't receive the proper signals to move food along, causing stagnation. This stagnation allows bacteria to grow in places where they shouldn't. People with diabetes often experience nausea, bloating, and slow digestion due to this problem. For what are the main causes of SIBO? A. Bariatric surgery, weight loss surgery, can disrupt the normal flow of food to the intestines and allow bacteria to grow in the wrong place. B. Diabetes, especially with long-term effects, can lead to nerve damage, affecting the normal function of the digestive system. C. Other gastrointestinal issues. Certain conditions, such as Crohn's disease or ulcerative colitis, can also affect the intestines and increase the risk of SIBO. D. Fourth cause, people who have a natural deformity in the shape of their colon or those with colonic ulcers, which we refer to as ulcerative colitis, an autoimmune disease, can experience SIBO. There are different types of ulcerative colitis, such as ulcerative colitis or Crohn's disease. It is important to note that certain medications we take can affect the movement of the stomach and intestines. A slow movement of the stomach and intestines can also cause SIBO. Now, you might ask, what are the symptoms? Let's break it down. 1. Bloating and gas. After eating, you may experience significant bloating and gas in the abdomen. This happens because the bacteria, now in the small intestine, consume carbohydrates like starches, and this leads to production of methane gas. The bacteria ferment these carbohydrates in the small intestine. 2. Chronic diarrhea. The second symptom is persistent and severe diarrhea. This is caused by 2 reasons. 3. The bacteria release toxins that increase bowel movement and cause diarrhea. 4. The bacteria interfere with fat absorption because the bile salts, which are crucial for fat digestion, are broken down. This leads to poor fat absorption, resulting in watery stools. Additionally, the stools may appear light in color. 5. Foul-smelling stool. The stool may have a very unpleasant odor due to the large amount of methane produced by the bacteria in the small intestine. The high methane levels cause the stool to have a particularly strong, foul smell. 6. Pain and cramping. You may experience constant and severe abdominal pain and cramping. This is caused by the buildup of gas from the fermentation of carbohydrates. The increasing gas pressures the walls of the intestines, resulting in discomfort. 7. Excessive burping. There's often excessive burping, which is caused by the gases like methane and hydrogen from the small intestine. 8. Nausea and possible vomiting. This is more common in people with diabetes. The gas in the small intestine presses on the diaphragm, causing a feeling of nausea and even the urge to vomit. 9. Alternating diarrhea and constipation. One final symptom can be alternating diarrhea and constipation. For example, you may experience diarrhea for a week, followed by severe constipation. This cycle can repeat. This happens because methane gas in the colon can slow down the colon's movement, causing constipation. Once the methane concentration decreases, diarrhea can return. All of these symptoms can lead the doctor to suspect that the person may have SIBO, small intestinal bacterial overgrowth. Second topic. Is SIBO a serious disease? Can it cause long-term health problems? It's important to understand that the symptoms we will discuss are not just limited to digestive issues like constipation and diarrhea. There are also major health concerns related to SIBO that go beyond just these symptoms. The two biggest problems caused by SIBO are 1. Nutritional issues. Fat malabsorption. People with SIBO often struggle with absorbing fats properly. This happens because many of the bile salts, which are necessary for fat digestion, are broken down by bacteria before they can help in digestion. As a result, the fats are not absorbed properly and are excreted in the stool. This causes a deficiency in fat-soluble vitamins like vitamin A, vitamin D, and vitamin K. That's why people with SIBO often suffer from vitamin D deficiency and its related symptoms like weak bones, fatigue, and weakened immune function. 2. Constant fatigue and weakness. Carbohydrate depletion. The bacteria in the small intestine consume carbohydrates, which are the primary source of energy for the body. When the bacteria use up carbohydrates, the person may feel tired and exhausted throughout the day. 3. Vitamin and mineral deficiencies. Vitamin B12 deficiency. The bacteria in the small intestine consume vitamin B12, which is essential for nerve function. As a result, people with SIBO often experience symptoms of anemia, such as dark circles under the eyes, dizziness, blurred vision, and poor concentration. Iron deficiency. The bacteria also absorb iron, leading to iron deficiency anemia. This can result in pale skin, weakness, and fatigue. 4. Unexplained weight loss. Despite eating normally, people with SIBO may lose weight because their bodies are not absorbing enough nutrients. This happens over time as vitamin and mineral absorption decreases. 5. Nerve issues. This is more common in people with diabetes. When there's a deficiency of vitamin B12, it affects nerve function, causing symptoms like tingling or a pins and needle sensation, coldness in extremities, memory issues, and lack of focus. 6. Skin problems. Due to deficiencies in vitamins like iron and zinc, people with SIBO may develop skin problems, such as dryness, cracks, and unexplained rashes. Second major problem, liver issues. This is a more serious and long-term concern associated with SIBO, particularly if it persists over years. This problem involves fatty liver, also known as non-alcoholic fatty liver disease, where fat accumulates in the liver cells. How does this happen? The presence of bacteria in the wrong place, the small intestine, leads to production of toxins. These toxins, along with other harmful substances, leak through the intestinal wall into the bloodstream, a condition called leaky gut. These toxins then travel to the liver through the portal vein and accumulate in the liver cells. This causes inflammation, as the body's immune system attacks the foreign substances, the bacteria toxins, and the liver cells begin to get damaged. This damage stimulates the liver to store fat, as it is unable to process the normal fats efficiently. Insulin resistance. The toxins can also interfere with the insulin receptors in the liver and muscles. The result is that these receptors become less sensitive to insulin. When the pancreas detects high blood sugar, it produces more insulin to try to regulate it. However, because the insulin receptors are not functioning properly, the insulin is less effective, causing a rise in blood insulin levels. This leads to insulin resistance, a condition where the body's cells don't respond to insulin properly. With increased insulin levels and reduced effectiveness, the liver is prompted to produce more fat, contributing to the development of fatty liver. This cycle worsens over time, leading to non-alcoholic fatty liver disease, NAFLD. These two issues, nutritional deficiencies and liver damage, are the most serious consequences of SIBO and can have long-lasting effects if not addressed. Third topic tonight is, how does a doctor diagnose SIBO? After discussing everything we've covered so far, how does the doctor diagnose SIBO? There are 3 important methods to diagnose it. 1, breath test. This is the most common test used. In this test, the patient is given a large amount of sugar dissolved in water or lactulose syrup, after a certain period. The levels of methane and hydrogen gases in the patient's breath are measured. These gases are produced by the bacteria in the small intestine when they rapidly ferment the sugar provided. The reason for this is that the bacteria in the small intestine break down sugars, releasing methane and hydrogen as byproducts. 2, endoscopy with biopsy, gold standard test. This is the most definitive test to confirm or rule out SIBO. In this procedure, a scope is inserted to take a sample biopsy from the small intestine. The sample is then analyzed to check for bacterial presence and to culture the bacteria. While this test is highly accurate, it is expensive and not always necessary. Most doctors will start by treating the patient for SIBO, and if the treatment works, they'll confirm the diagnosis. If treatment doesn't help, then further testing, like taking a biopsy, may be considered. 3, blood tests. Blood tests are used to check for specific deficiencies that are common in SIBO. The most noticeable deficiencies in people with SIBO are vitamin B12 and iron. Vitamin B12 is essential for nerve function and red blood cell production. A deficiency can lead to anemia, fatigue, and neurological symptoms. Iron deficiency is another common issue because the bacteria in the small intestine consume iron, leading to iron deficiency anemia. These deficiencies help doctors narrow down the diagnosis and differentiate SIBO from other conditions with similar symptoms, like lactose intolerance or other digestive disorders. In summary, these diagnostic methods help the doctor confirm whether the patient has SIBO and rule out other possible conditions with similar symptoms. The breath test is the most commonly used, but in some cases, a biopsy or blood test may also be needed for more accurate diagnosis. Title 5 and final one tonight is, what are the treatment steps for SIBO? After understanding the disease, its symptoms, causes, and potential problems, especially with the liver, what are the treatment steps? Here's how we approach it. 1. First and most important step, antibiotics. Antibiotics are essential for managing SIBO. The most common antibiotic used is rifaximin, usually in large doses ranging from 1,200 mg to 1,600 milligrams daily. The treatment duration typically lasts 2 weeks to 4 weeks, depending on symptoms. The purpose of this antibiotic is to reduce the bacterial concentration in the small intestine, which in turn reduces the toxins they produce that affect the liver. For elderly patients over 60 years old, or those with specific conditions like diabetes, alternative antibiotics like clindamycin or flagyl are used. Important note, you should never use antibiotics on your own. Overusing antibiotics without a doctor's guidance can lead to antibiotic resistance, which is a global issue. Only use them when necessary and prescribed by a healthcare provider. 2. Second step, prokinetic medications, e.g. domperidone or metoclopramide. These medications are used to regulate the motility of the colon, making it function more normally. They help push the bacteria back to their proper place in the colon, preventing their overgrowth in the small intestine. However, prokinetic medications should never be used alone. They work best when combined with antibiotics to fully address the issue. 3. Third step, dietary changes. The most important step in treating SIBO is dietary changes. A low FODMAP diet, a diet low in fermentable carbohydrates, can help. This diet reduces the foods that feed the bacteria in the small intestine, promoting their reduction. Oh, you'll need to avoid certain foods, like those high in lactose, and focus on foods that are easy to digest. Over time, this will help the bacteria return to their natural place in the colon. Oh, note, the exact reason why the bacteria return to the colon after following this diet is not fully understood, but has shown effective results. 4. Fourth step, regular vitamin and mineral testing. Oh, regular testing for vitamin and mineral deficiencies is essential. Oh, common deficiencies in SIBO patients include iron deficiency anemia. Treat with iron supplements. Vitamin B12 deficiency. Treat with B12 injections or oral supplements. Vitamin D deficiency. Treat with high doses, 50,000 IU weekly for 2 months, then lower doses for maintenance. Oh, these deficiencies should be corrected over time to help with the patient's overall health. 5. Fifth step, be cautious with probiotics. Oh, many people claim that probiotics are a cure for SIBO. However, this is not always the case. Oh, while probiotics may help in some gut health issues, they can worsen SIBO because they may add more bacteria to the small intestine, exacerbating the problem rather than alleviating it. Also, avoid using probiotics in SIBO treatment unless specifically directed by your healthcare provider. These treatment steps, when followed carefully, can help manage and treat SIBO effectively, reducing symptoms and preventing long-term complications like liver damage. I'll stop here for today, and we'll continue our discussion, God willing, in the next video. I hope I provided you with new and useful information. Please, if you like the video content in the channel, give a like, and don't forget to support the channel on Patreon, PayPal, and also on YouTube. Wishing you well. Hussein Lotfi.